to Dr. Tom because he has been voted by you Best Cosmetic Surgeon for 9 years and Best Aesthetician for his team for 3 of the last 4 years by Press Democrat readers. All right, so today we've got Dr. Tom and Karina Lozano, who's the surgical liaison, and today we're going to talk about tired eyes. And there's one way you can sort of hide them, sunglasses. But they're not practical all the time, right, Dr. Tom?
Well, if you're as cool as you are, Michelle, you can wear sunglasses anytime,
right.
anywhere,
Indoors,
right?
Who cares? Yeah.
Yeah, and so, well, first of all, I want to, again, thank Karina for inviting me back. I say to her show, you're just so regular here now, Karina. And for those who maybe have tuned in for the first time, Karina is actually she wears many hats in the office. She's our medical assistant. She actually is a surgical assistant and surgical scrub tech with me. And she is our surgical liaison. So she is my everything. Sounds like a Motown song. So Karina, thank you for coming back.
Thank you for having me back.
Thank you. And since we're thanking people, we want to thank Michelle in particular. Michelle, we've been working together on and off for how many years?
Like 17 years.
17 years. Yeah. And I really appreciate you being here for us. So thank you on Ask the Expert. We love you. Thank you. So anyways, today Karina and I were talking a little bit about it, and you reached out to me as to what kind of show should we talk about today. And I'm going to start off by asking Karina, you're there with me seeing all the patients. You're my everything, right? And so when we meet with these patients, Karina, what are some of the common complaints that they will come and see?
There's a reoccurring one. I look tired. I'm tired. I look tired. Maybe I'm not tired, but I look tired.
Absolutely. Yeah. I'm hearing that more and more, and I think, world's a little crazy right now. I think we all are a little tired, and that's not necessarily the emotion that we kind of want to put out to the universe, right? That we are tired, and I get that a lot. And it's interesting that even though we tend to think we get that from older patients like Gen Xers and baby boomers, we get the fair amount of that from the millennials and the Gen Zers.
So,
yeah, everybody. So when I'm evaluating those patients, and I know that you're not on your phone, you're actually listening to what I'm saying as we're talking to the patients there. What are some of the first things that I talk to the patient about in terms of them looking tired and what we might do for them?
Yeah, of course. Most of the time our first line of treatment is going to be a little bit of Botox.
Okay.
It's an easy introductory if they've never done anything, easier, downtime, all of that stuff. So that's always kind of like your first, what about this?
Absolutely. Yeah. And so for those who don't know what Botox is, everybody knows what Botox is. It's a protein that's made in a lab, and what it does is it relaxes our muscles. And if we look at our eyes, Karina, a lot of times I talk to the patients as if they're our eyes. Talk about the eyes are the window to the soul, but look at them as a window. It's that top part, or like a blind, where we see that top part falling down. Okay, and so one of the best ways to try to elevate our eyebrows, is by using Botox. And so usually, where do I start, Karina, with that first sort of area of injection to relax muscles?
Yeah, could be in the frown area, so the area when we get those deep 11s that you call them.
Right, the 11s.
That is usually your first one, but one area that some people don't think about are the sides of the eyes.
You jumped right ahead to where I was heading. I love it. So absolutely, Karina is correct. And one of the very first areas that I'll recommend to someone is to treat their frown, which is the area between the eyebrows, or the 11s, and so you have to understand there are 3 major muscles in that area. One right in the middle between our eyes, and it pulls down, and it's called the procerus muscle. So definitely we want to inject that muscle to relax it, so it will allow a release, if you will, for our brows to come up. Then we have 2 sausage-like muscles on each side of that middle muscle, the procerus, and they're called the corrugators. Think about like corrugated cardboard or something. So the corrugator muscles, and they pull our brows not only together towards the middle, causing the 11s or that frown look that you talked about, Karina, but also pulls down a little bit. So relaxing those will actually allow the outer part of our brow to raise a little bit. And in women, they love that because they like that arched look of their eyebrows. Okay. You had mentioned, and actually, let's just backtrack for a second. So absolutely the frown, that's number one. That's an area that we should treat to kind of open up our eyes, make us look not as tired. Also, a side benefit of that is that we don't look as angry,
Mm-hmm.
okay? And that can really make a difference on how people interact with us. You know, if you see somebody who looks angry, we tend not to want to go and interact with them
Right.
socially. Where somebody's smiling and has this nice bright countenance to their face, we want to go and reach out to them,
Right.
right? Okay. So, you know, that's for most people. Now, a lot of times when we're dealing with young people, how old are you?
Oh, I'm an old lady.
Just because you have
At
two kids doesn't
heart.
make you, come on, how old are you?
So, 28.
You're 28. Oh my God. You were 24 when I heard
I
you,
was a
right?
baby.
You were a baby. Okay. So you're 28 years young. But when you first started working for us and we kind of were experimenting with some of the treatments that we have, you know, what you might like to try as a patient, were you surprised that I recommended treating the sides of your eyes with Botox?
Yes, yes.
Okay. You thought I was going to recommend the frown area, right?
Yeah, the
Right.
most one.
Most
The most
peop-
recommended one.
Right, exactly. So what people don't understand is we have this muscle that goes around our eyes, and it's called the orbicularis oculi. And when we smile, it constricts down, or when we close our eyes. And so that tends to pull our eyebrows down when it's active. So actually, injecting the sides of your eyes, which most people think I'm doing that to diminish crow's feet or smile lines, and yes, we are doing it for that reason as well. But if we inject on the side of your eyes, we can prevent that downward pull of our eyebrows on the side
Right.
and help them to lift up. So that's key. And I love doing that for the young staff members like yourself. We like, geez, I'm not sure where I want it.
Right.
And they're thinking I'm going to recommend it for the frown area. And we check the side of their eyes. And it's this subtle look and subtle improvement. But all of a sudden they look at themselves in the mirror and they say, wow, my
Yeah.
eyes are more wide
More
open,
awake.
right?
Mhm.
And you felt more awake,
Yeah,
right?
and also one thing that most people, or one of the things that I notice is that when you're taking a photo and you're smiling, your eyes tend to close.
Right.
And so that definitely, if you're, we photograph a lot. We
do.
We do. Dr.
Right.
Tom loves his photos. So yeah, a lot of the times your eyes close. So it definitely help with keeping those eyes awake too.
Absolutely, and especially for me, I'm Chinese and Greek, but I look mostly Chinese, is that with my Asian eyes, we tend to have our heavier lids and hanging down. I need to do everything to kind of open up my eyes.
Right.
And so one of the things that I do for sure, if I only had one area to have injected with Botox, I would inject the side of my eyes.
Right.
That's the area that I would have injected. So we've talked about that. If your lids are in excess, just so you know, one of the simplest things to do is actually an upper eyelid skin removal, or what we call an upper blepharoplasty. We tend to talk more today. We're going to
Right.
talk more today about medical things, but certainly if you think you have excess skin hanging down over your eyelashes and you want to be considered for eyelid surgery, it's a very straightforward procedure. We just did two
Yep.
procedures on Wednesday,
Yep.
yesterday, I guess
Yes,
that was,
yesterday.
and it just gives you this big, wide open look. And so if you're just even wondering whether you're a candidate for an upper blepharoplasty, call our office, speak with Karina, who's our surgical liaison, and she'll have you send in photos. We'll take a look at it, and if we think that you're a candidate, we'll set up a Zoom meeting or an in-office meeting for an evaluation for that. And so a straightforward procedure, little downtime, and it can definitely open up your eyes, and it's still the #1 treatment for opening up your eyes, in my opinion, surgically. So that's
Yes, of course.
That's it on surgery. So now we'll keep
Yeah,
on moving
surgical.
to medical. So that's surgical. So one of the other things that we talk about, and I'll actually mention it to patients, Karina, is under the eye.
Yes.
What do the patients tell you if they might be talking to you first before I walk into the room about the under eye
Yes.
area?
Sometimes a patient can notice a little bit of hollowing under the eye.
Right.
Or they can even say there's kind of like these bags. There's little bags there that I'm seeing, and I didn't used to have them when I was younger, and now they're there. So
Right.
two different things, either hollowing that makes you look sunken in, tired, or maybe bags that, could say, oh, didn't sleep so well last night.
Correct. So if the bags are severe, those bags under the eyes, then I might refer you to one of my oculoplastic surgical colleagues for a consultation regarding that. But for most people, that's not going to be required. So what happens as we age, Karina, and you know, I look at you and beautiful 28-year-old young lady, even though you have 2 kids and they're running you ragged, okay, is that we begin to lose volume in our face, okay, and as we do that, our cheeks, you know, most of us have fuller cheeks. Even if we're really skinny, we tend to have fuller cheeks. What happens is we begin to lose the volume in our cheeks, okay. So our cheeks sit up on our cheekbone, and everybody can just sort of touch your cheekbone, but those cheeks are right there, and that's where when we were younger we have this little apple. That fat did not go all the way up to underneath our eyes. It did not, if you look at your photos in high school and so forth, even elementary school, but it did go up fairly close to our lower eyelid. That volume, when it becomes less or begins to decrease, that compartment, that cheek compartment, begins to sag down, and as it sags down, it then exposes a second layer of compartments, if you will, underneath there, and that's where people see either hollowing as potential, or if there's fat in that area, they see an exposure of that fat under the eyes. Okay, so what do I usually recommend for those patients when we see them?
A combination of 2 things.
Okay, all right.
Sometimes you recommend a little bit of filling in the cheeks, a little bit of filler to kind of bring up that, you know, what is it called? The window seal. Build around it.
You've been listening to our shows. Good for
listen.
you. Okay. So you're right. So let's just stop with that one first. So I mentioned that initially, and is that first compartment, the cheek compartment, okay, begins to lose volume. A lot of times when people are concerned about underneath their eyes and the hollow, what I'll tell them is just put your finger horizontally underneath your cheek and just push up. And as you push up, you'll notice that your cheek now all of a sudden has a little bit more of that apple, if you will, look, or more volume in that area. And you'll also notice as a side effect that under your eye, that hollow is less. So by just adding volume to the cheek area, and of course you have to know the key anatomic points to put that volume, by just doing that, you'll help to minimize that hollowing underneath the eyes. So what kind of, what do we normally recommend to patients in terms of revolumizing the cheek area, Karina?
Restylane.
Okay, so filler.
Some Restylane, some filler.
Okay.
Or other fillers that we have is usually good. Sometimes, you know, you recommend the Renuva that we also carry in the office.
Perfect, right.
So that is also an option.
So filler is hyaluronic gel, okay, so it's a sugar kind of component that's in all living matter and animals, and is a part of our natural collagen, and so that is Restylane and Juvederm and some of the other fillers that are out there, and so it's very nice. It lasts, they say, about a year. Probably doesn't last quite that long, but lasts about a year for those, and so we will inject it in the cheek area, and that helps to plump up the cheeks and push the cheeks up, and helps to minimize underneath the eye. And usually that's the first area that I would want to treat, and very much as you said, you were talking about the window seal, Karina. What I consider the window seal is directly under the eye, or that hollow. So really what the filler does is we're recreating the wall that's holding up the window frame. Okay, so we're adding to the support of the eye, or the window to the soul. So by adding volume underneath, we push that tissue up. We help to minimize, just by doing that, the hollowing underneath the eye, and we're setting up the basic structure to kind of lift up the face. It's not a facelift, but it does add enough structural support by adding or replacing the volume that was lost.
Right.
You also mentioned Renuva. Renuva is cadaver fat. It lasts a little bit longer, so comes from a tissue bank. For those who didn't know, I used to be a kidney transplant surgeon, so it's kind of right in my wheelhouse in terms of using things that stimulate our own biology, or they're called biostimulators. And Renuva, or cadaver fat, is an excellent choice. And we just saw a patient who I think had a very nice result that we treated about 3 months ago. So that's the foundation, and I think, did you have a question, Michelle? Oh, Michelle is just adjusting our volume here.
I am, yeah.
Okay.
Well, you're adjusting volume in our faces as well, but does that also, like, there's skin that we have right on the outside of our faces. I don't know why I'm explaining that. We all have skin on the outside of our faces, but like it only will cover a certain amount of area. So when you're adding volume here, it's sort of like is it stretching, sort of the skin underneath the eyes? Like, how does that? I'm just wondering physically what that's doing there.
So some of the volume that's there will actually kind of lift up, and it changes the reflection, if you will, of the way the light hits that area. It's not going to necessarily stretch out that skin or crunch it together more, but you're changing the reflection. And it's amazing how just a little bit of volume in the cheek can make your eyes pop. If you look at photos of yourself, take a selfie. You know, we're talking about liking photos in our office. Take a selfie and just be totally deadpan. And what will happen is you'll see your eyes don't really sparkle as much. And that's because the light from above is hitting down on your cheek, which is somewhat deflated, and it bounces down towards the floor. But by adding volume, when we smile, so think about when we smile, big smile, right? And we bring our cheeks up, we change the reflection of the skin of the cheek and the way that the light from above is hitting it, and it reflects up into the eye. So we get more of that sparkle in our eyes, even if most of the time, Karina, you mentioned that our eyes get a little bit tinier when we smile, unless we've had Botox on the side. So that's a good reason to do it. But even though our eyes may get a little squinty, especially on me with my Asian descent, that your eyes sparkle because you've changed that reflection pattern. So I think that's important for us to know. Thank you, Michelle.
Sure.
So Karina, you mentioned the filler or the Renuva as part of our structural support. What else can we do under the eye that will help that? I'm trying to ask you to guess what I'm thinking about, but really it's more the finish work. What else can we do?
So once we've kind of helped the patient out in all those other areas, then we can go with easy PRF gel directly under the eye to help what they're actually coming in for, where they're saying, look, it's hollow, look this.
Right.
So it takes a little bit of trust.
Right. It does take some trust. Okay. So what is Easy PRF gel? Can you tell the audience?
Easy PRF gel is their own blood.
Okay.
So we're drawing up and spinning.
Okay.
And then
how many tubes do you draw?
Two tubes.
Okay.
And
2 tubes.
so not a lot.
Okay.
Enough for what we're doing.
Okay.
And we're heating and cooling one. So, and it's their albumin.
Okay. Which
that's my cue.
That's your cue.
That is like the protein, the egg white.
There you go.
Yes.
Okay. All right. So the albumin. So you're in one of the tubes. You're basically cooling it down to pull out the patient. Excuse me. You're heating it up.
Correct.
Excuse me. You're heating it up in order to pull out the protein or the albumin. And this is where Karina is the mad scientist. Okay. And she's doing this. So you're warming the one tube up for the protein. What are you doing with the second tube?
The second tube we're keeping cool to keep the platelets from clotting. So we don't want it to clot quite just yet. We want it to remain cool, and it's the yellow gold. We wanted to keep it that
yellow
way.
gold. Okay, so yellow serum. So it's the serum of the yellow colored fluid in our blood, and it contains platelets, and along with those platelets, it has other factors, healing factors, fibroblasts. I can get all fancy and techno nerdy on you, but I'm not going to mention that now. But basically what it does is they're the paramedics of the body. I use that frequently. And so what the PRF does is it's activated paramedics. So PRP is sort of like paramedics, and they're kind of sauntering in to take care of a problem. PRF is like all the alarm has been signaled, and you get all this PRP that's coming in and activated, and it has the healing factors and so forth, and it can improve the quality of the skin. It may add a little bit of volume, but it's not the primary purpose, but it's to enhance the quality of the skin. What do we do with these 2 tubes?
So we'll heat one, let it sit there, and it turns into from liquid to a gel consistency.
Right. Okay.
And then we combine the heated and the cool together, and it gives us a beautiful yellow tube of it's almost like your own filler. It's just gel,
right.
Your own gel and then Dr. Tom will inject it under the eye area, and sometimes even into the cheeks. I see you go in the cheek or kind of in that.
What we just did today on our last patient,
bit, so.
Before we came over to the station. So it is your own filler. It's again, it's a biostimulatory, so it's signaling your body to start to do a reparative process in terms of enhancing us cosmetically. But what it's doing is it's making our area healthier. Okay, so we're restoring healthy components to that area that we're lacking. And so what it does is it improves the quality of the skin, as well as with the protein. You mentioned it's a gel-like substance. It's your own body's filler, and it adds a volume in that area. So I'm enhancing, or I'm sort of topping off the wall, okay? So filler or Renuva in the cheeks, and then we're using your PRF gel, and I'm using that to sort of layer down right under the windowsill, and then the PRF Pure right under the skin as the windowsill itself. So that's going to help with the reflection. One, we're going to look healthier, and then also it's going to change that reflection coefficient of light, so it hits down onto that area and bounces up into our eyes and makes it look brighter.
Right.
Okay. So when we do this procedure, what can a patient expect over the next couple of days or even next couple of weeks and months?
So as far as immediately, Botox is no difference. You go home, you notice it in a week. Filler, it's immediate. There's not much swelling. Easy gel, there is a good amount of swelling, a more significant so a little bit more of downtime, but then it reabsorbs, and then slowly you'll start to see that your skin looks better, the body is kind of activating a little bit of collagen and making it look fuller for you. Right.
So again, Botox takes about a week to kick in. Filler is immediate. Renuva, or the cadaver fat, is immediate, although you'll be a little more swollen, so some of that swelling will go down, which you will miss, like, oh, I missed that swelling, don't go away. Okay, some of that swelling will go down. With the Easy PRF gel, you'll definitely be more swollen, so you have to be aware of that. You will be more swollen, but the effects are beautiful, and everybody's different. We had a patient just today that we did perform this on, and she was a little bit anxious, just like, when is this going to go down? And I told her, because she's not a bruiser at all, that I think even by later this evening it will look less, although it will still look puffy. But remember, that's kind of the end goal. We're trying to kind of plump up that area, and then over the next couple days, I feel for her that will go down, and maybe somebody who sees her every day, they may notice that she had something done, but most people kind of interacting with her socially, I don't think they're going to know. In fact, I think she's going to look better because of that added volume. Okay, so that's Easy PRF gel under that area. And then there's another area. You mentioned Renuva, which is the cadaver fat, and you know there's another area when I'm treating around the eyes that I'd like to do. Do you know what I'm thinking of? Can you guess what I'm thinking about?
There's two that I'm thinking. I hope I say the correct one.
No, they're probably both correct. Go for it.
Okay, so under eye. Okay. Under the eyebrow, and that's what I meant, and
under
then
the eyebrows.
Temples.
Right, okay, so I actually consider those together, but you're absolutely spot on, Karina. I love it. So what happens is when we lose volume, we just don't lose it in our cheeks, okay? We lose it in our foreheads. And by the way, we're going to be on YouTube, and I'm hoping to have it posted by tomorrow. And when you look at that, you're going to see the beautiful 28 years young Karina, and you're going to see this baby boomer me, and just look at her foreheads, okay? Karina does not have a fat face, even though she's mostly Latina, okay? But look at her forehead, and then look at my forehead as you're looking on the YouTube video, and you'll see that she has just this fine layer of fat on her forehead. Her daughters have more, okay, because they're younger, obviously. And then look at my forehead where it looks a little bonier, okay? So as my forehead also loses volume, it tends to descend, and so your brows tend to drop and can lead you to looking tired as well. So one of the things that I like to do, and now we're kind of getting more into the surgical world, but under local I can do some liposuction, limited liposuction, getting fat, and I like to inject it in the forehead area, and I love that look. I think it's a real natural look where actually it lifts up the brow, but some people don't want to take that time. There's a little cosmetic downtime with that. So what can we do when they just come in and they want something done and want to carry on with their life? Okay, everybody's too busy, right? Is we will use Renuva, or the cadaver fat, and I will actually, and I inject some local, I will actually put it directly underneath the eyebrow, okay? Sometimes they say upper eyebrows, but that's the only place they are is in the upper, okay? Not the lower eyebrow, and I haven't found one of those yet. But what we do is we inject that right underneath the eyebrow, as you mentioned, Karina, and that actually tends to lift the eyebrow up. Part of that as well, in confluence with that, is to add the area in the temple area. And a lot of times I'll get patients coming in, Karina, and they'll say, I look skeletal, okay? And in fact, we were, and just in the show here, we were just, right before the show, we were talking about Halloween. And so, Skeletor, they'll even say, oh, I look like Skeletor because my temples are getting so hollowed. Renuva, which stimulates your own personal body's fat growth, your own fat growth, another biostimulatory, is great in this area. So one, it makes you look healthier because it's not so hollowed. But I also go up high above the eyebrow, and as we revolumize that area, it actually lifts the brows up as well. So that's another favorite area that I'd like to inject. So you are correct. All right. So boy, we covered a lot in this short period of time.
Wow.
There's really so much, and all different kinds of techniques too. So it can be a combination of these techniques. Really, it is tailor-made for each particular patient.
Absolutely, patient specific, and usually it is a combination of technologies that we want to use for the patients, Michelle.
So great. So be sure to reach out to Dr. Walter Tom of Dr. Tom Cosmetic Surgery. You can call for a free consultation and really be able to send in your own pictures, come in and take a look at what's going on by calling 707-542-8346. 707-542-8346. Dr. Tom has offices in Santa Rosa, also Napa and Maui. And you can also look at before and after pictures, which also give you a fun idea, online at drtomcosmetic.com.